Now, this is not one of my chiropractic talks, it's one of my functional medicine talks. So, you know, I want to introduce a talk by looking at a problem that we have in our culture, and that's people that are chronically ill that can never find a solution to what's going on with them. Now, I'm not saying every one of those people have a stealth pathogen, but there's a lot of them that do. And so we're going to dive into that, how they get it. And I'm going to talk a little bit about, even though this part of this isn't going to be in your notes, about how many times I can tell just by looking at a standard blood test whether somebody may or may not have a stealth pathogen. So, what is a stealth pathogen? It's any microorganism that gets into the body that evades the immune system, okay, leading to chronic disease or lack of well-being. And that definition, Professor Kerry Bone is probably the #1 world expert on herbs and how they affect the body. He's done a lot of research in that area and published a lot of research in that area. Stealth pathogens can include bacteria, molds, yeast, viruses, spirochetes, of which, you know, syphilis is a spirochete, and parasites. You say, well, you know, do people really get parasites? Well, I pulled a couple of articles. Sorry. Hey, come on in. I pulled off a couple of articles online regarding parasites, and this is from the European Journal of Pathology, and it's called Stranger Things in the Gut, Uncommon Items in Gastrointestinal Specimens. In this article, they talk about how a lot of times during autopsies, they find parasites, okay? This one is called Common Intestinal Parasites. It's from the American Family Physician Journal. And it says there's a lot of people that have parasites. Now, most of the parasites they talk about in these two journal articles are what we call pathological parasites. So you get something and you get diarrhea or vomiting or something of that nature. But there's parasites that not all parasites cause those things, and there's parasites that can inhabit your GI tract and just cause low-level inflammation, low-level pathology that's really hard to detect. And these things often, especially if your immune system is compromised, can evade your immune system for years. Now, would you say in our culture right now there's people with compromised immune systems? Mm-hmm. Yeah. Okay. So tell me, just out of curiosity, what do you think would compromise an immune system?
Chemotherapy or radiation.
Yeah, chemotherapy and radiation, definitely.
Mm-hmm.
Definitely.
Lifestyle.
Who said that?
Lifestyle.
Lifestyle. Like what? Can you give me an example?
Eating crappy food all the time, not getting sleep, just running yourself ragged.
Yeah, okay. Burning the candle at both ends. I've never heard of an American eating a crappy diet. I'm sure somebody do. Sure somebody out there does, but yeah, that's right. So you eat a diet that doesn't have the nutrients that your immune system needs to function, and it's not going to work right. So can somebody name me one thing that your immune system needs to work right? Just one nutrient. And it's really common in the COVID era. Everybody talks about it.
Vitamin D?
Yeah, vitamin D would be one, yeah. Yeah, I was thinking of zinc. But yeah, vitamin D. So, you know, vitamin C, okay? Vitamin A, all right? So not everybody has enough of this stuff, and that compromises the immune system. And a compromised immune system can't fight off or can't identify stealth pathogens very well. So common symptoms of stealth infections can include fatigue, insomnia, anxiety, muscle pain, cognitive impairment, weight gain, recurring infections, and just general poor health. So they've been linked to a wide variety of health conditions like chronic fatigue, fibromyalgia. How many of you known people with the diagnosis of fibromyalgia and nobody can figure them out? Yeah, it happens. I mean, it happens all the time. Okay, yeah. Sarcoidosis, which is an autoimmune condition of connective tissue, cancer, just general autoimmune disease, and then Lyme disease. Okay. And there's a lot of autoimmune diseases that can be associated with stealth pathogens. And we don't have to go through all of these, but ankylosing spondylitis, Crohn's, rheumatoid arthritis, psoriasis. That doesn't mean that every autoimmune disease out there is caused by a stealth pathogen, but it does mean that there are plenty of them, and all of you probably know some people that have some of these that nobody can figure out what's causing it. Okay, so what happens when you have one of these problems here? Let's say rheumatoid arthritis or psoriasis. Let's pull out psoriasis. So let's say you have somebody with bad psoriasis. What's generally what is the general treatment for psoriasis? Anybody?
Steroids?
Yeah, steroids. That's right.
A cream.
Yeah, steroids. Okay. So is psoriasis a steroid deficiency? In other words, you were just born with steroid deficiency. No, it's not. Okay. Now, I'm not criticizing people that are taking steroids for psoriasis, but lack of steroids, not the cause of psoriasis. Okay, and we could go all up and down here. Let's look at hypothyroidism. I see that a lot in my functional medicine practice. So, how's that usually treated? Hypothyroidism.
Pharmaceuticals.
Yeah. Anybody remember which pharmaceutical it is? It's levothyroxine.
Yeah.
Okay. Yeah. So were those people born with a levothyroxine deficiency?
No.
Most likely. No. They were. I mean, when they were born, when they were babies, they had enough T3, enough T4. You know, their thyroids were working. Somewhere along the line, something happened. Okay. So with stealth pathogens, your body has essentially been hijacked by a pathogen which is able to evade the immune system. And this could come from past infectious diseases that were not totally eradicated. And a classic one is food poisoning. We all know people who've had food poisoning. I was back in the 80s, I went to Haiti, and I got food poisoning bad. I mean, I got it from some ice, ice cubes.
Yeah.
And boy, it was miserable, and fortunately, I beat it, okay, at the time. But a lot of people, when you start questioning them and asking them, they come in, they go, man, I just haven't felt good for years. And you ask them, well, when was the last time you felt really good? And they'll say, well, it was before that trip to the Belgian Congo, when everything went haywire. I ate some raw monkey or whatever it is, and you can always trace, or a lot of times trace it back to that. So if you can trace it back to when they had this issue, that they're probably dealing with a stealth pathogen. Parasites can be picked up in foreign countries, but you don't have to go to a foreign country to pick up a parasite. Where can you pick them up here in the United States?
In a lake.
Yeah, you can pick them up in a lake, swimming.
Yep.
Okay.
Yep. Swallow water.
Anybody in here when they were little kiss their pets?
Oh yeah.
Remember how we used to kiss our dogs? We didn't know.
When you're little, what do you mean?
Yeah. That's right.
Yeah.
Yeah. Some of the people that bring their dogs in, they still kiss them. I see that. So yeah. So animals have parasites, and we can get them like that. Okay. So bouts of mononucleosis, like, you know, teenagers get that and they never quite get over it. And then chronic diarrhea. Okay, somebody that's just chronic, might have a stealth pathogen. Now, not every teenager that doesn't get over mononucleosis has a stealth parasite. I treated one gal, it's probably 12 years ago now, that came in to see me, and they were ready to take her to Mayo's, and really what she had was an adrenal dysfunction and an autonomic nervous system dysfunction. She responded just fine to some nutrients and chiropractic care, and she's doing great now. She had some organ issues too, but it was not. But some people do. Some teenagers, they get this and they never get over it. By the way, what's the thing that causes mono anyway? Anybody remember the organism that causes mono? It's Epstein-Barr virus. Okay, and you can test for that. Okay, somebody has mono, you can test for Epstein-Barr. I've done it. And in fact, I had a patient who, this is a couple of years. This is in 2019. This is December of 2019. I had a patient who she had just chronic fatigue, and she had mono a couple of different times. This is a woman, you know, she's in her 40s. And so I did an Epstein-Barr test on her, and sure enough, it came back high positive. So I put her on a protocol, which I'm going to show you later. And then during December, remember, we're talking about 2019, she got pretty sick. What do you think she might have gotten sick with?
COVID.
COVID, yeah. This is before, but she had all, but this before we knew anything about it, you know. And later on, she told me, now I don't know if this is true or not, but she told me, she says, you know, I think that protocol you put me on may have saved my life because of how sick I got, you know, and it helped her through it. So anyway, we'll talk about that in just a few minutes. So let's talk about Judy Mikovits. She's a PhD in immunology. She wrote this book, which I recommend everybody read if you can, called Plague of Corruption. Incredible woman, and she's had over 50 different publications in scientific journals, and she found that viruses can be transmitted to humans from vaccines cultured in animal tissue. Okay, so how does this work? So many animals carry viruses that are just endemic or unique to them. I mean, they carry them, you know, it doesn't affect them that much, but if they're transmitted to humans, okay, then it can be a real problem with us, okay? So if we get those viruses, they can cause diseases not associated with what we call a vaccine. So transmission is silent, meaning your body's immune system is not altered to fight the invader. The pathogen could be said to be stealth, like a B1. Now this is right out of her book, like a B-1 bomber with radar cloaking and deflecting materials and angles. So once established in our body, these pathogens can actually change our DNA and cause other problems like cancer and other diseases that we wouldn't even associate with that. So how did she figure this out? Well, in the early 2000s, she and her fellow researcher discovered that much of what was diagnosed as chronic fatigue syndrome was caused by a virus called xenotrophic murine leukemia virus, and it's XMRV. So, you know, this word means mouse. So it was a virus that come from a vaccine grown in mouse tissue, where a virus that was endemic to the mouse was now being transferred to people, and it was causing havoc in people. Okay, and what do you think? Now, this discovery right here was published in one of the most prestigious journals in science, a journal called Science. Okay, what do you think happened?
Got buried.
Didn't get buried.
Mm.
What do you think the liability of the government is if they're vaccinating people that are getting chronic fatigue from their vaccines? What do you think the government's liability would be? It'd be huge. Okay, so once they figured out what was going to happen, they put an enormous amount of pressure on her to retract that article and say she lied or her data, and she wouldn't do it. Okay, because I mean, at first she was celebrated for discovering this, and then she was cursed. Okay, and she talks a lot about it. You know, she had these people following her around, and all kinds of things happen. It's in the book here. Very interesting. But so she found that this virus in mothers with chronic fatigue syndrome could also pass the virus to her kids, resulting in autism. So what do you think that created? Okay, not good. All right. So this was pretty explosive. Okay, and you don't hear about this in the news because the media they wouldn't cover it. So she didn't find that every single person with chronic fatigue had this virus, but she found a lot of them did. Okay, simply because chronic fatigue syndrome, not all chronic fatigue comes from a virus. I mean, some of it can become from, well, let me ask you this. What else might cause chronic fatigue other than this? She found a lot of it was this, like maybe 70%, 70, 80%. What about the other 20%? What else could cause chronic fatigue? Anybody?
Could there be a breakdown of blood because the word leukemia is in there?
Okay.
And that bothers me because my father died of leukemia.
Well,
why are they throwing that word in there with XMRV?
Because they're finding out that XMR, once you get a virus in your body from an animal, it can change your DNA and cause all kinds of
Kind of
things.
cancerous then?
Yeah.
Oh boy.
So
Oh boy.
yeah, that's why it was such a big deal.
Yeah.
So what I'm asking you though is what else do you think could cause chronic fatigue other than a virus?
One of our watchers says too much stress and stress hormones.
Yeah, that would be a legitimate answer.
Anxiety?
Anxiety, possibly. How about gluten intolerance causing thyroid issues?
Allergies.
Gluten intolerance could do it. There's chronic stress causing adrenal stress and maladaptation of what's called the HPA axis, hypothalamic pituitary adrenal axis. That could cause it. So there's other things, but she found that a lot of the chronic fatigue people that she tested had this virus. Where'd they get it? Vaccine. Okay. So now here's where it really gets interesting. Okay. She found compelling evidence that Ebola was transmitted to humans in the same way. Because in Africa, when they were vaccinating, when there were these vaccine campaigns in Africa, what they were doing, they were culturing the vaccines in chimpanzee tissue. Well, Ebola is endemic to chimpanzees. Chimpanzees carry Ebola, but it's generally not transmitted to people, okay, except if you culture vaccines in chimpanzee tissue, then there is a transfer. And you read that chapter in her book, she presents very compelling evidence that this is how Ebola started getting transferred to human beings, to humans, okay? So how do we effectively and naturally eradicate these critters, okay, that get into us? Well, we have a stealth pathogen protocol here. They're very, very specific herbal formulas, and I'm going to go through these. This is a general one right here. I have a different one for parasites. If I know that the person has primarily a viral issue, then I'll change this a little bit. And one of the ways I can tell that, at least sometimes, I'd say maybe a lot of times, is looking at the differential, the complete blood count with differential in the blood work. So if I see, like, for example, they have very low neutrophils, very high lymphocytes, and the white count is normal or a little low, it's probably a chronic viral infection, okay? If I see that the white count is normal but the lymphocyte or the neutrophils are high and the lymphocytes are low, that's probably more of a chronic bacterial infection. So you can kind of see, you can get an idea just from blood work of what they might be dealing with, people might be dealing with. These are the 4 products that I normally use. Now, let's get Myrrh Forte. It comes from a tree, the sap of a tree in Africa. It has antimicrobial, antiparasitic, anti-inflammatory, and wound healing properties, okay? Clinical studies suggest using high doses for treatment of parasites that infest deeper in the body. So other uses include for myrrh, problems in the mouth like gingivitis, chronic laryngitis, the cold, bronchitis, diarrhea, gut, liver, and bladder parasites, boils, and abscesses. So myrrh's it's a really pretty good general antibiotic. Artemisinin, its common name is sweet wormwood. It was historically used to treat malaria. And there's somebody in 2015 won the Nobel Prize in Medicine for its effects against malaria. So historical uses, treats hemorrhoids, it helps people live longer, induces hair growth. They use it for lice, boils, fevers, and anti-tumor, anti-cancer. Now, I wouldn't get up here and say, hey, if you got cancer, I'm going to give you this and it's going to fix it. But they've noticed that it has these properties over time. And Carrie Bone has done a lot of research on these herbs and found that. Artemisinin also includes sarsaparilla. It was used back in Europe, way back in the late 1400s against syphilis. It's a blood cleansing herb, anti-inflammatory, anti-rheumatic, and decreases symptoms of bacteria die-off. And Viranon, really good for viruses, contains 3 antiviral herbs. St. John's wort. Anybody heard of St. John's wort? Okay. Usually we hear about it for anti-depression. It's good for people with depression. Very powerfully antiviral as well. Licorice and Thua. So St. John's wort works really well on enveloped viruses. Now, can anybody give me the name of a common enveloped virus that we have all heard of? Anybody in here ever heard of AIDS?
Yes.
HIV?
Yes.
That's an enveloped virus, okay.
What does enveloped mean, the enveloped virus?
It means that they've got this protein coat around it,
Okay.
and the body cannot recognize it because it looks like protein. It doesn't look like something that it has to attack.
So that's why it overwhelms the immune system.
Yeah,
So I
that's
just
right.
buy,
Yeah. It's effective against oral and genital herpes. I don't exactly have a lot of people streaming into my office for these problems, but this is what I've heard, okay?
That include like cold sores?
Can be used as acutely or as a preventative and helps support mood, which is, so high-grade licorice, again, effective against enveloped viruses, influenza, pneumonia, supports gut barrier integrity, and effective for adrenal function. Licorice is in most of my adrenal products, or a lot of them. Really good for adrenal stress. Thua, really good for warts. Effective, again, enveloped viruses, essential oils can be applied topically. It has antimicrobial and antifungal properties. So let's I'm just going to run this by you real quick. What about molds? So how do you know if somebody has a mold issue? How can you, let's say you think you might have been exposed to molds, you think maybe your problem is from a mold. How would you know that? Anybody? Okay, there are tests for that. Just want you to know that. You can actually order lab tests for molds to see if you've got some of those floating around in your body. Now, fortunately, the mold issue is a fairly simple problem to fix, and I don't even have I don't even carry the products for it. But you use activated charcoal and bentonite clay, and you alternate those back and forth, like maybe 3 days on charcoal, 3 days on clay. And usually I tell people, if they think they have a mold issue, I said, we can do the test, or we can put you on this inexpensive, simple protocol for a couple of months and see if you get better, okay? Because the tests are not that cheap, okay? So that's, and I just tell people, go to Natural Grocers, because I don't carry those products. But it's real simple. Echinacea, great product, powerful immune stimulant, helps with bacterial, viral, and fungal issues. One of the ways you can tell if Echinacea is good or not is bite into it, just chew it, okay? And if after about 2 or 3 minutes your mouth starts to get real tingly and numb, okay, it's good Echinacea, all right? And ours does that, by the way, because I've used it. Garlic can be a very powerful antifungal and anti-worm worm product. I use garlic primarily for yeast infections. Good anti-yeast product. So these protocols can be mixed and matched depending on the issue. Usually it's called the 4-14 protocol, where give them 4 days of 2 products, and then we stop those 2, and then we put them on 9 days of the other 2 products. Why would I do that, by the way? Why would I do this?
So the body doesn't get used to it.
That's exactly right. Great answer. So whatever you're trying to eradicate in the body doesn't start adapting to what you're giving them. So that was a problem with antibiotics, is that you start giving people antibiotics for a while, those bugs learn to get around that and adapt to it. So we don't want them to do that. So this is a protocol that I put patients on. And if I suspect they have a stealth pathogen, you can go on this protocol. It's not going to hurt you. And, if you get better, you get better. But if I'm looking at blood work and I think, wow, you might have a stealth infection here based on what I'm seeing, then, I might recommend that. So, if you had a vaccine of any kind and you haven't been well since then, other than the RNA vaccine, which is completely different than the vaccines I'm talking about here, you might want to try the stealth pathogen protocol. So, Judy Mikovits, I did a talk on vaccines a while back, and some of the stuff I talked about was what she had talked about during an interview that I saw her do. So what she says, if with the mRNA vaccine, if you get that and you have a lot of problems with it, she said that the primary way to get that out of your body is through fasting or intermittent fasting. Mm-hmm. That's the way that she knows to do it. So I talk about intermittent fasting in some of my other talks, okay? And we can do that at another time. So this is what I do, and usually I put somebody on this protocol for about 3 months. About 3 months is what it takes, and then they're done. They're all done usually, okay? I don't necessarily do like a maintenance program. This should usually do it, okay? So that's all I have for today. Anybody have any questions about anything I went over? Yes.
One is, what would be a symptom if you had an issue with mold? What would be the symptoms of that?
Could be anything, chronic fatigue.
You know,
Just tired
manifests
all
a
the
lot of
time.
ways.
Yeah, sick all the time. You never feel well. That would be one issue. Usually, when people know they have mold because they know they've been exposed to it. Most of the time, okay. I mean, if you don't know, you can always test for it, or you can just do the protocol and find out what happens.
And then second question, what's this mRNA vaccine that you're talking about?
That's the
The COVID one,
that's COVID vaccine, the first one they came out with.
Pfizer and Moderna.
Pfizer?
It's the, what was it? It was the first one from
Moderna.
Pfizer.
and
Pfizer, Moderna.
Yeah, the Pfizer and Moderna. Yeah, that's the vaccine. Yeah. So, good. Yes.
If you have parasites but you don't know it, but you want to take something that'll cleanse the inside of your body, what can you take that'll eliminate parasites?
Well, I would do the stealth pathogen protocol. I would change it from this and to more of a parasitic type formula.
Like a little more myrrh, a little more.
Less myrrh, a little bit more wormwood.
Okay.
Some of the other things that I have for parasites.
Okay.
Yeah, that's what I would do.
Good. Yeah.
Okay, good. Thank you very much for coming tonight. Appreciate it. Next class is going to be on how the food industry destroys our brains. Okay, that's a real interesting talk, and I hope you come for that because we're going to have a lot of information that you probably never heard before. And there's some foods that you probably want to either get out of your diet or really restrict in your diet. So we'll talk about that next. Is that next week?
Mhm.
Yeah, next week. Okay, great. Thank you very much.